Hello all. I am going to be discussing my tableau right here because I've been doing so much work on it for my expensive notes on medical school for chiropractors that has so much overlap with any conservative alternative medicine. So I'm just like getting these ideas as I go. I try to upload and type in my notes fresh and put them where they need to go. I reclass stuff. So even when you see my database, which is all pulled from a simple Excel document, what you get is, what is going on here? So what you get is basically, I was going to go into, so those are more notes that I want to pull up because I want to add it together. I know I'm rambling on. Hold on. So you go to my site, www.themassagenegotiator.com, and then you're going to go to the front, and you're going to see right here, health body region info. And you can also explore my site as well. Great advice, healthy, comfortable living, conservative treatments. Oh shoot, you got 1 day and 10 hours left to get your promo rate massage. So anyways, you go to the health body region info. Explore your data with this database. Explore with me as I add chiropractic foundational health to this database. This page is to help you navigate your body as I update this work in progress. Tableau public desktop server database to help you as I run through my notes in medical school for doing just that as a chiropractor. I have more to add, but for now, explore your skeletal muscle and common chiropractic assessments you can use on yourself for educational purposes only, to explore your health as well as loved ones or for understanding your own body, because you know what? A dashboard can do that. We can understand so much more. Don't just see the black and white and the words and the numerous descriptors. You can key it in to your body and see what you need to know. So let's just actually look at this in Tableau because Tableau has made some wonderful speed adjustments so that if you see this, you're going to have the most use if you look at it on a desktop. So I have arranged these, but because I have a couple of separate dashboards, you're going to have one that's anatomy and bone tumor imaging reviews, tools of wellness. So you're going to have the OIANs, which is origin, insertion, action, innervation. So if you have a lesion, it's in an area of the body. It's going to pinpoint to what area where the attachment is, scroll through, and you're going to see the innervation to the nerve roots. I got the body viscera and brain nerve supply. So if you're just curious, you're just like, what's going on here? Where are these nerves coming from? Like, what is it? Sympathetic, parasympathetic? Like, what is it? And then we got the spinal column. This is going to tell you a lot to do with your spine and where all those nerve roots come out of. Also got, like, if you're just, like, quickly looking and you're just like, oh, hey, this is just the spine region. This is the description right here. Oh, the facets. Oh, okay. Let's just make sure I'm going in the right direction because, you know, I know where that facet is shaped. If I'm rotating my head, laterally flexing it, extending it. Am I restricted? Is there more movement? Is it comparable? But, I mean, of course, you're not going to be doing your own procedures, but you could stretch. Sure, why not? You could do mobilizations on yourself. They actually call that something called Mulligan's mobilizations, part of physiotherapy. All right, and then you got the arteries and veins. See if you're bleeding out when you see some deep bruises. You want to take your MMA skills to the next level. Look at these arteries and veins, these nerve locations, where the peripheral nerves are. Yeah, because we could be the next Jake Paul and just pull super belts out of our ass, right? Yeah, because we just know the body location and we know how to get out of it, because then we're just going to be like, oh, well, you know, I know what this is right here, and you ain't going to do shit. You can't flex your bicep if I take this nerve brachial plexus right out of your armpit. All right, okay. So anyways, we got the lumbosacral plexus, arteries and veins, brachial plexus, general bone tumors. I didn't select that one on the next page, but this one is the main one, diagnostic process. You could see where the overlap is. Let me explain to you So you got a diagnostic testing. What do you need for it? Basically, if it's not there, I probably didn't fill it in, or it's just like a general pathology, like imaging just in general, so I won't really have anything there. And sometimes it has too much stuff there. Ultrasound, usually you're going to need that for a lot of things. So what happened was I didn't just include the body region. I also included recently, I reclassed stuff as you go through it. If you want to see CT, what do I need for CT? Which is actually more radiation than an x-ray. And it's less time to get it. Definitive diagnosis with radiograph. So you can't even diagnose in a lot of these things unless you get a radiograph, and then you would have to know what pathology. So what sort of pathologies do you need? Facet dislocation, fracture of the lumbar spine, claviculaar fracture. Yeah, Jefferson, lumbar spine, teardrop fracture. Okay, you got osteomyelitis. You got fractures of the glenohumeral joint. You got burst fractures. These are all like MVA type fractures. You can also see those on X-ray. But they're listed under CT because you can get better soft tissue joint articulation in some cases with that. Whenever you see definitive diagnosis, there's a couple of different things. Let me just clear out of this. And so I put in there, because if you can diagnose it definitively based on soft tissue or muscular irregularities, abnormalities, dysfunction, then it'll just have, physical exam on it. But a lot of these, you have to actually have X-ray technicians in office or have that license certification and the machine, and then of course the status to diagnose, which is a doctor's status for diagnosis. So keep that in mind. But why not? I mean, massage therapists can be doctors. I mean, especially if you have the same training, you can be diagnostically prepared. It takes more time, but nothing more than a regular massage office visit. And then you get a thorough assessment because you're actually palpating and you're healing with your hands and you're testing it out. You're ruling out things. You're getting more personal with them. They understand you. So you're not just in there pitter patter. Oh yeah, so move your neck this way. Okay, that way. Okay, yeah, you probably just have some shoulder luxation or right C5-6 or whatever. So anyways, advanced imaging. So what does advanced imaging mean? Anything that's not radiograph. And I have categorized radiograph not as such, but as X-ray, because that's what it is. It's a fancy way of saying, hey, this is my niche. Stay out of my niche, because we call it radiographs, not X-ray. Okay, bitch? Yeah, stay in your lane. But no, because X-ray is just what it is to the layman, so that's what it's going to be. This body key is for anybody to use. XFT, now that is kind of more specific because it's actually for an abbreviation for cross fiber friction, which massage therapists can do. The wrist, you want to see what wrist is, what conditions do I have in here. You're going to have some possible diagnosis, some stuff you can check out with radiology, which is X-ray. You can see the chiropractic health theory, what it could be theoretically, with the description, generalization, if there's any procedures. For adjustment or palpation, you don't do the adjustment really unless you want to do a mobilization, because you can do a mobilization as long as you know what you're doing and you're not trying to intentionally injure somebody, but just get a little bit more range of motion or some soft tissue compression relieved. You got coding and billing for any of this stuff, what it would fall under. Let's say someone comes in with bladder complaints you suspect. Well, they're going to need a 99202 at least, which is an evaluation management for diagnosing, the first code. That's something that somebody that diagnosis does. If you're a massage therapist, and then you don't see any 9921s because they have to actually go get referred if they have a bladder problem, because it could be a bladder stone, it could be bladder rupture, it could be bladder cancer. I mean, it could be anything that you suspect. And if you go into because bladder cancer, bladder comes up in abdominal percussion, palpation, pain, bladder regularities, cystochely. Cystochely in females when the uterus goes forward and collapses on the bladder, making you feel like you have to pee all the time. Stones, of course, tract infection. Your UTIs are probably the most common one, and in fact, it will tell you by the history. Flank pain, irritated pain, obstructive bladder. Yeah, so just check it out. Go back to the key. Always go back to the key. This is like your little eye to the world. So you look through it, it's just the lens, okay? So advanced imaging, you'll see what I had classified, which is basically anything here. Let's go back to the diagnostic process, which advanced imaging is going to be CT, MRI, or ultrasound. And I have ultrasound in here. I want to go back to this definitive diagnosis because also in labs, I haven't added labs yet because there's a lot to add to labs. I only have blood and urinalysis, which would be under here. If I just remove everything, you just go to CLD, which is clinical lab diagnosis. Not in that key, but right here in this screen right here. Let me make sure I don't have anything marked. Wait, let me go to ultrasound. Okay, yeah. Ultrasound, any of these you can diagnose. I know uterine fiber is pretty common. Finger pain is chief complaint. Pathologies, you can look at the pathology. What is it? What are the symptoms? What causes this? What's the history? How does it start? Who is more prone to get it? The diagnostic testing that a conservative alternative medicine treatment would provide. And then the definitive diagnosis is made with advanced imaging. So sometimes radiograph, but they still want advanced imaging because you can see some things. If radiograph only takes fractures, and if it's decreased space or if it's like osteoclastic, blastic, lytic, osseous, it'll show it. But in recent fractures and stuff like that, and some soft tissue, unless it's a long-standing condition of at least more than 2 weeks, you might not see it on radiograph. So you can diagnose it on radiograph if it's there and it's been a while, but not in all cases. Okay, so then you would need like a CT, which is good for like joint articulations, and then sometimes they have to add treatment. So those would all be refers anyways because they have to add like technetium or galadium or any of that stuff. Advanced imaging of ultrasound. Ultrasound, actually, if you have a certification in it, you can do it yourself unless it requires the use of injecting a needle, which is outside. You would have to have a registered nurse as well. And then you would, if you're a registered nurse as a doctor, it's under the medical scope, which is chiropractors, conservative alternative medicine, stay out of that lane of medicine diagnostics. So you would actually have to be a nurse practitioner to prescribe it, the needle injection, to see the ultrasound and have the ultrasound and be a chiropractor. Or, because it's within the chiropractic field to observe that and diagnose it for a soft tissue condition. Some people say use the highest one, so if the other one is without that scope, then you have to stay within your scope and choose which one. So either way, you have to work as a team. Yeah, so let's go out of this one. I'm just going to take you through each and every one of these keys. So how long has it been? 13 minutes? It might take another 5 minutes. Abdomen. Anything related to abdomen. What do we have here? So we got coding and billing, theories. Oh, yeah. This is why it's taking a while because, these notes, I'm writing these in myself. Okay, you're going to see some typos. That's my signature. I didn't use a program to copy and paste. I'm doing this and learning, relearning, and everything else. I'm changing, making changes. Okay. All right. If you do want to just keep it, you just right there, and then you can either refresh the screen. You got the theories, you got the procedures, which are assessments for abdomen. You've got rebound tenderness. That could be for the inguinal area, for the appendix. You got liver palpation, kidney, jar test. That's for if you have some kind of stretch from ruptured organ, visceral, other leakage, something like that going on. You would use that if whatever it is you suspect, of course, because this is for educational purposes, but you can explore it and you can rate your doctor on how thorough they were with you. And if you felt like they were not providing you adequate service, yeah, go ahead and reference it. It's to this, the only Southern California chiropractic school that runs like a cult, of course. But all of their material I have cited because I would not even respect them enough to use any of the information if I didn't know it actually came from a textbook. So these are all the textbooks, and they are expensive. And I do have almost all of them. Some classes I didn't really need to get because they were so old, and they said, nah, you don't need to get the book. I got it. Like neuroscience. I have a little bit of neuroscience, so I was going to add a little bit more because that is obviously necessary. If you go to the brain, right here. You might see some reference course items, pathology GA2, general anatomy 2, neuroscience. Here's a neuroscience one. I can actually keep neuroscience, and then it'll show all the neuroscience classes I have on there if you wanted to go explore that little rabbit hole, but you don't have to get lost in it because you can just click out of it. Oh, okay, so where are you? Where are you right now? What do you want? Okay, look, let's see. Coccyx. What is a chiropractor having to do with okay, well, there's some conditions in the radiology whenever you get your x-ray certificate of that. There's some procedures, some mobilizations, theories. I haven't set up the coccyx to do that just yet, which is amazing because it's most likely going to be in the spine or pelvis. So then you would go to the pelvis. If it's not coccyx, go to pelvis. Okay, a lot of times the coccyx has to do with like injuries sustained from carrying pregnancy that was like irregular or trauma to the pelvis, MBA, stuff like that. AP coccyx, okay, theories, diagnostic, fibrous dysplasia, groin injuries, adductor. A lot of these are not physical exam. They are actually radiograph or they're generalizations because groin injuries can be anything. Pharynx could also be throat. I might classify it as throat. I clicked out of it. Okay, let's go to some of these ones that aren't body parts. So we got adrenal glands. That's where you're going to find all those crazy people that are like super mad or super depressed all the time. Or they're just like metabolic, working out all the time and not doing anything because they got catecholamines from corticosteroids just going crazy in their body. And you can read about that. So I also didn't classify, for some reason, the adrenal glands did not get classified. So as I go through this, I'm also realizing that as well. There should be some in theories, but because there's not, it's probably an endocrine, because anything that secretes fluid is going to be an endocrine. All right, let's see. Okay, emergency treatment, when to have an emergency, that's what that is. CT is CT. Connective tissue, that's like skin or bone sometimes, or it could just be fascial, myofascial, you can check that out. Congenital is right in there. There's so dermatological areas. I just didn't want to make the extra skin one because then I'd have to go back at that time, and there was like a bunch of stuff to use, and then the alternate names for it could have been fit in anywhere. So congenital, that's like a special testing thing. If you have anything congenital or autoimmune, that is not a standard lab. That means genetic testing. You need to have genetic testing to confirm that. And the diagnostic testing, it'll tell you what you can get from labs. It can indicate maybe there's something there. Labs. Some of this should be special tests. So some of it is special testing, like because sodium chloramine perspiration, pilocarpine test, that's special. Trisomy 21, that's genetic. That's for Down syndrome. I mean, you can see those things, obviously, but to officially confirm it, you would have to have the special testing there, unless it's already been confirmed by a medical doctor. Okay, and then let's go to colon. I added colon because many people are like, the colon, what's the difference? Colon, large intestine, intestines, and you know, there's going to be overlap. So if you go to intestines, you'll see it too, but you'll see just a lot more because it'll include the small intestines. So the colon, okay, is like mostly like for stuff related to the colon, because our diet does have a high prevalence of killing people and injuring their colon as American diet, standard American diet. Over time, that and our stressful lifestyles of always being stressed, working at our desk, always trying to fight time and do a project and have time for everything else, and knowing you made sacrifices that you can't actually fix again because you didn't keep up those social constructs. Okay, colon, we got, this is for radiology positioning. You can actually see this with x-ray. Sometimes, though, they do actually need some sort of like a barium contrast or something like that. Lateral sacrum view, AP sacrum, AP coccyx, AP abdomen. So this is what the radiology positioning. If you want to go into the actual imaging, I might have made, you would have to go into X-ray, MRI, or CT, or ultrasound, because that's the only ones I've added so far. I didn't, or advanced imaging, but it wouldn't show X-ray. Okay, body region null. Here's some pathologies: abdominal imaging, appendiclith, fecal stone, colon carcinoma, mechanical bowel obstruction, appendicitis, chronic recurrent IBS, ineffective filling medication. So you can see how useful this is. It's only been about 2 minutes. I mean, just to explore how fun it is to look at data. Yeah, and you have full access to it. And I'm adding more because there are many notes and PDFs from my time in school. 3 years served. So that was medical school. Very, very costly. And you probably would better see yourself working in a place where they don't run it like a cult. So somewhere where there's more like a democracy, and something where it's not do as I say, not as I do, because they do things that you know aren't right. And so when you do them, then hey, like uploading videos to social media that they're given permission to. A brief permission. Like, okay, yeah, sure. Right, all right, whatever. Damage is done. It's not going to be replaced. So anyways, I'm building this up because all conservative medicine, you should know that chiropractors started off being bone setters, which are just people that just crack people's backs. And then also magnet healers, which use magnets. Okay, that's the founding person. And then throughout the year, they had different branches because people disagreed on the use of other things like X-ray to diagnose or other stuff. It's kind of like the Amish, and then the people that are like, yeah, but we can be like Hutterites or whatever and use technology. So anyways, they branched off and they went through their own legal processes. And we have the Sherman-Wilkes Antitrust Act. So everybody should be capable, if they have a thorough education in the STEM sciences, medical diagnostic, thorough pathology, immunization, the stuff that they need, the tools that they need in their toolbox to make a definitive diagnosis and manage someone's health, they should be allowed to. And there's no reason that because acupuncturists are doctors as well, and they follow a program. Massage therapists need that level too, because it is great when you have a massage therapist, but there still isn't there is a defined way of doing things. Like they got effleurage, they got petrissage, they got instrument-assisted soft tissue mobilization, they got hot stones, they got aromatherapy. They got different modalities, right? And then you are the first person there who has access to their whole body other than their private regions for conservative modesty. And you're working on their system, autonomic nervous system, their parasympathetic nervous system. And look where I have parasympathetic system. I have it in theories. It's just the nervous system division. Let's see where this one comes from. There should actually be a lot more than this because I put them in. I mean, I might have spelt them wrong, though. I don't know. Sometimes it doesn't link up if I don't have it spelt right. And there should be a whole bunch that are in there for that. Okay, but then let's go to the sympathetic. And some of these might not have actually gotten loaded because I'm on the free version. Sympathetic nervous system. Yeah, okay, so we have it there. Alzheimer's, autoimmune. You can scroll down. Depression. Yeah, there's supposed to be a lot more. Like, I will show you. Oh, yeah, because I'm in. Okay, so it's not going to show you everything inside my website. So what you want to do is you just want to go here and view the big one because I'm going to test it out right now. There should be a lot more here. Yeah, because it's pretty slow. It's you got slow and then you got super slow. So don't use the super slow one. It should be right here. Let's see. Yeah, see this? So you're only going to get the tip of the iceberg if you use it inside the site. You want to click into it. I don't get anything off of this. This is a free public tableau.com. It's free and it's actually owned by Salesforce, and they lost so many people and got a bad blood name whenever they tried to just only make it payable. So they gave it free because it's a way for all the data scientists to get together and work on changing the world one idiot at a time. So it's really great. Yeah. And you might be able to see my profile and all the other stuff I did here. Check it out. Help yourself out to it. I've made some private. These was the original ones. Every time I update it, actually it'll add to the views. So most of these are actually just me. But I do have some people that I know that they use the information from my articles, or else they had an AI machine use it inside my third-party permissions that created articles just for me, like on uterine fibroids or whatever. So, all right, go ahead and help yourself. If you like this video, go ahead and like and subscribe. And together we can change the world and make massage so much better and diagnostic. And I'm always adding stuff to it. It's for educational purposes only, which education should be free in America. We really need to get with the rest of the world that are doing things like that.